Hi, Dr. Adriana Huertas with 𝗔𝗔𝗍𝗂𝗃𝗧. Today I want to talk to you about spinal decompression. So spinal decompression is one of the most advanced services that we offer at 𝗔𝗔𝗍𝗂𝗃𝗧. Now, we do it because we have a lot of patients suffering from debilitating back pain that are trying to avoid surgery at all costs. So spinal decompression does three things, okay? When you're looking at a disc injury, most likely it means that the disc is being compressed. So what we're trying to do with spinal decompression is actually opening the space by decompressing your spine. So when you open the space, you untrap the nerve. So if you are compressed like that and you open the space, that nerve is going to be very happy. So we're going to be able to calm that sensation of pain, numbness, tingling, or even weakness. Now, the second thing that spinal decompression does is when there's compression as well, it tends to dehydrate your disc. So if your disc is dehydrated, it's going to get splattered and it's going to enclose the space even more, again, putting pressure on your nerve. So with spinal decompression, we open and close, which what we do, we're trying to create a pumping mechanism that is going to attract a lot of fluids into the space and it's going to rehydrate your space and increase that, okay? Third thing that it does is that when there's a disc injury, most likely there's either bulging or herniated. What's happening is that the disc is now going out into the space, as you see here. When it goes down into the space, it's going to create significant pressure on the nerve, right? So with the spinal decompression, you're creating that pull pattern that is opening and closing is also creating a negative pressure that is going to push the disc back into the space. So then you're not constantly putting pressure on the nerve, okay? Now, those are the main three functions of spinal decompression. When you look at the benefits, number one, it is cost effective, it is non-invasive, okay? It is a natural approach. We're trying to avoid surgery, so that's a huge one. We're not depending on medication as well. It is pain relieving, it can increase your mobility. There's so many benefits. In fact, the most benefit for me is seeing a patient not having to have surgery. That's by far is the best. But here's the thing, if you do need to learn more, this is what you need to do. Visit 𝗔𝗔𝗍𝗂𝗃𝗧 so you can learn more. Bye.